Welcome to the Deep Dive. Today we're unpacking a really fascinating challenge. How do we actually study therapies that, you know, don't always fit neatly into that standard medical box?
That's exactly right. Back in the early 90s, this was a big question for the NIH, the National Institutes of Health.
Oh, right, their Office of Alternative Medicine.
Precisely. They basically got a panel together and asked them, look, do we use the same research rules for these, well, unconventional therapies? Or is the whole worldview so different that we need, I don't know, a completely different approach?
Okay, so that's our mission today then. Let's dive into what that panel figured out. What are the sort of core principles for researching complementary and alternative medicine, CAM, effectively and fairly?
Yeah, and hopefully this gives you, the listener, a better lens to look at any health claim, really.
So where did they start? What was the big insight?
Well, it sounds almost simple, but it was kind of a game changer. They realized the focus shouldn't be on the therapy itself dictating the method. Instead, the research design should always flow from the specific question you're asking. The question comes first.
Okay, the question comes first. So what makes a good research question in this context?
Right. Well, it needs to be clear, explicit, focused. And really importantly, it has to be practicable. Can you actually do the research?
Can you give an example of maybe an impractical one?
Sure, like asking if, say, fennel oil strengthens the heart chakra. If there's no agreed upon reliable way to measure heart chakra strength, then, well, the question might be interesting, but it's not really practicable for research right now.
Makes sense. And it needs to be important too, right?
Absolutely. The answer should matter. Could it actually help people, alleviate suffering, address something a community cares about? That's key.
Okay, so question first. Now let's get to the really big question, the one everyone wants to know. Does it actually work? Does the therapy cause a clinical effect?
Ah, yes, the cause and effect question. And for that one, the panel agreed the randomized controlled trial, the RCT, really is the gold standard.
Even for unconventional therapies?
Well, they did this fascinating thought experiment. They imagined a world with zero practical limits, no issues with funding, recruitment, whatever.
Okay.
And they concluded, yeah, even then, for nailing down cause and effect, the RCT would be the way to go.
Why? What's so special about the RCT?
It's built on some core assumptions, like cause has to come before effect, obviously, and critically, that a researcher's hopes or beliefs can't directly cause a physical change without the actual therapy doing something.
Ah, so it's designed to stop us from fooling ourselves, basically.
Exactly. It minimizes bias. It's our best tool for figuring out if the therapy itself is responsible for the outcome.
But reality check. RCTs aren't always possible, are they? Sometimes they're too expensive, or there are ethical problems, or maybe the therapy itself is hard to standardize or blind.
That's true. Practicality is definitely get in the way sometimes.
So what then? If you can't do an RCT, do you just give up on the does it work question?
Not necessarily give up, but you have to be aware of the limitations. You can use other study designs like case control studies or cohort studies.
But they aren't as strong for proving cause and effect.
Generally, no. They're less rigorous. And the sources we looked at had examples like acupuncture for quitting smoking or using lavender oil for perineal discomfort after childbirth.
Okay.
Initial studies, the less robust ones, looked promising. But then when more rigorous RCTs were done later...
Let me guess, the effect wasn't so clear.
Right. Often, no significant difference was found compared to the control group. It really highlights why, for that core does it work question, the RCT is paramount if you can do it.
So it's not just about RCTs then?
No, not at all. That's the mosaic idea. RCTs are crucial for cause and effect, but there are so many other important questions in CAM.
Like what?
Like, understanding what patients believe about a therapy, or tracking how many people use it and why, or exploring how different practitioners deliver it. For those kinds of questions, different study designs are perfectly appropriate, often better.
So it's about picking the right tool for the specific question you're asking, not just defaulting to one method.
Precisely. And building knowledge step by step, a strategic approach.
Meaning, don't jump straight into a massive, definitive RCT with something totally untested.
Exactly. The panel liked models like Dr. Dundee's research on a P6 acupuncture point stimulation for nausea after surgery.
How did that work?
Well, it started smaller, non-blinded pilot studies first, just to see if it was feasible, get a sense of things. Then they moved to the more rigorous blinded RCTs, and then even open trials in practice. It's a progression.
Building the case piece by piece. Okay, that makes sense. And finally, interpretation. Getting the data is one thing, but understanding what it means. That's another challenge.
Oh, absolutely crucial and easy to get wrong. For instance, finding a statistically significant result doesn't automatically mean it's clinically significant.
Meaning,
Well, an effect might be real according to the statistics, but so tiny it doesn't actually make a meaningful difference to a patient's life or health.
right. And the opposite error, too. Like saying something doesn't work when the study was just too small.
Yes. That's the classic absence of evidence is not evidence of absence. Especially with small pilot studies, they might lack the statistical power, basically, enough participants to detect a real effect, even if it's there.
So you can't just say, see, it doesn't work based on one small negative study.
You really shouldn't. It's about looking at the whole picture, the totality of the evidence, critically evaluating the methods of all the studies, not just, cherry picking the ones that fit a pre-existing belief.
So this deep dive really underscores that researching these therapies, whether they seem conventional or unconventional, isn't about throwing out the rule book.
Not at all. It's about using the rules, the rigorous methods, thoughtfully, adapting them.
It all comes back to asking the right question first.
Exactly. Ask the right question, pick the best tool for that question, and then be really careful and honest about interpreting the answer.
And it feels like this approach, this question-focused thinking, empowers everyone, doesn't it? Practitioners, researchers.
And you, the listener. It gives you a framework to cut through the hype sometimes, whether it's for CAM or even conventional treatments, and ask, okay, what's the actual question here? And what's the evidence really telling us?
A powerful reminder that clear thinking and rigorous, unbiased inquiry really do benefit everyone. So next time you hear a health claim, maybe pause and ask yourself, what specific question is really being asked here? And what kind of evidence would genuinely properly answer it?